everyone. How are you all? I hope you all are doing good. Nowadays, we all are hearing a disease condition, the black fungus. Usually, it is a Mucormycosis disease, and we are seeing it a black fungus disease. And nowadays, we are seeing that the cases of black fungus disease are increasing day by day. And so, what is this black fungus disease? What is mucormycosis? And what are the causes of mucormycosis? Why this disease condition is we are hearing nowadays? Why this disease condition we are hearing nowadays only? And what is treatment for it? What are the diagnostic procedures for it? And what are the preventive measures or the steps we can take to prevent a particular individual from the infection of this black fungus disease or the mucormycosis. So if you want to know all about this disease condition, so stay tuned with me and watch video till end. So first of all, I want to clear why it is known as black fungus disease. Uh, Fungus name is given to this disease condition because it is caused by a fungus. We all know disease condition can be caused by any of the species, like by the bacteria, by the virus, but this disease condition mucormycosis, as this is caused by a virus, so this is known as the black fungus disease. Okay, fungus is clear. Next, why it is called black fungus only? Because if you have seen through the Google or the YouTube videos or through the news, if you have seen any of the patient, or if you are a healthcare provider directly, you have seen any patient in your hospital who is suffering from the mucormycosis, so you have seen that the person is having like black moles. We will not say it moles. These are the group of molds that eventually convert the tissue or the affected part into the black color. So this is mucormycosis, is also known as the black fungus. So next, about the mucormycosis. What is mucormycosis actually? Mucormycosis, sometimes called zygomycosis, before it was also known as zygomycosis. It is a serious but rare fungal infection caused by a group of molds called mucormycetes. As I already told you, the affected person will be having, as you can see in these pictures, here every picture has black molds. So because of these black molds only, this mucormycosis is also known as black fungus disease. These fungi live in throughout the environment, particularly in the soil and in the decaying organic matter such as leaves, compost piles, and the rotten wood. Next, people get mucormycosis by coming in contact with the fungal spores in the environment. For example, the lung or the sinus form of the infection can occur after someone breathes in spores. These forms of mucormycosis usually occur in the people who have health problems or take medicine that lower the body's ability to fight germs and the sickness. Mucormycosis also develop on the skin after the fungus enter the skin through a cut, scrape, burn, or other type of the skin trauma. So mucormycosis is common nowadays. Especially we are seeing this condition is occurring only in the COVID recovered patients or the persons who are dealing with the COVID patient. Why it is so? Because usually if you have seen, the fungus disease or the fungus infection is less common among the animals and human being, and it really cause any life threatening disease condition or any life threatening problem. But if the immune system of the person is very weak, or if the body of the person is affected by any other disease condition like diabetes, hypertension, or any of the infection which suppress the immune system of the individual, at that time this particular fungus, not this fungus only, at that time the fungus take the advantage that already the immune system of the person is suppressed. So fungal take the advantage and invade the human tissue. So sometimes these fungal infections are also known as the opportunistic infection. So if the immune system of the individual is very strong and it is very means it's the person is not having any other comorbidities, so that time fungus will not be able to affect the body of the individual. But due to disease condition, especially in the COVID patient, as we all know that due to COVID, the person already have a weak immune system, so at that time this fungus get the opportunity and affect the host body. So therefore mucormycosis or the fungus infections are sometimes also known as the opportunistic infection. Next, we will see the different types of the mucormycosis. So the types of the mucormycosis depend on the site of the bodies that is affected. So first one is the rhinocerebral, sinus and brain mucormycosis. If the fungus is affecting the brain and the sinus of the individual's body, that type of the mucormycosis is known as rhinocerebral mucormycosis. It is an infection in the sinuses that can spread to the brain. This form of mucorcynosis is most common in the people with uncontrolled diabetes and in the people who had a kidney transplant. So the person who had a kidney transplant or the person who has a diabetic uncontrolled diabetes, like if the person is having uncontrolled diabetes, so he will be having the complication of like diabetic ketoacidosis. So at that time there is increased level of the acetone in the body, so it called the acidosis. So ultimately it also uh, affect the tissues and destroy the tissues of the body. So ultimately it cause the damage of the tissue. So if the person is having any kidney transplant, so if the person is having kidney transplant, it means the immune system of the person is also weak, so he can get the infection of the fungus. So the type of the fungal which affect the brain and the sinuses is known as sinocerebral mucormycosis. Second one is the pulmonary mucormycosis. As the name suggests, if the lung of the person is affected, then it is known as the pulmonary mucormycosis, and it is mostly common in the cancer and who had organ transplant or the stem cell transplant. Next, okay, next one is gastrointestinal mucormycosis. So gastrointestinal mucormycosis, it is most common among the young children than the adults, especially premature and the low birth weight infants less than 1 month of the age, who have had antibiotic surgeries and medication that lower the body's ability to fight germs and the sickness. Means if the baby is less than 1 month of age, also if the baby is if the baby is premature, at that time the medications which we are giving to the baby or the surgery which we have done with the baby, already the immune system of the baby is not that much strong. So, and at the same time, we are also giving the antibiotics and other supplements, and the surgery also we have done. So, it weakened the immune system of the patient. So, ultimately, the baby can got the infection in the gastrointestinal tract. So, if the gastrointestinal tract is affected by the mucormycosis, that is known as gastrointestinal mucormycosis. Next one is the cutaneous mucormycosis. Cutaneous mucormycosis means skin infection occur after the fungi enter the body through the break in the skin, for example after surgery, a burn, or the other type of the skin trauma. This is the most common form of mucormycosis among people who do not have weakened immune system. And the cutaneous or the skin mucormycosis, it is common in those patients only whose immune system is not weak but they have cut in their body, they are already burn patients or they have done any surgery in their skin. So at that time the fungus again got the opportunity to enter into their body through the skin. So this is known as cutaneous mucormycosis. One is disseminated mucormycosis. It occurs when the infection is spread through the bloodstream to affect another part of the body. The infection most commonly affects the brain but also can affect other organs such as the spleen, heart, and the skin. Means when the infection of the fungus reaches to the bloodstream, and through the bloodstream, as we know that blood is the connective tissue of our body, so through with if infection has reached to the blood, it can spread to any part of the body like heart, spleen, skin, anywhere. So that type of the mucormycosis, when it affect the bloodstream, is known as disseminated mucormycosis. Next, the type of fungi causing mucormycosis. So I have listed it. First one is Rhizopus species, second one Mucor species, third Rhizomucor species, fourth Syncephalestrum species, fourth Apophytomyces species, and Lynchemia formerly Aspidia species. So these are the species of the fungus which can cause mucormycosis in particular person. Next we'll see what are the signs and symptoms of the mucormycosis. So again, the signs and symptoms of the mucormycosis depends on the type of the mucormycosis in the patient. Either the affected part is a brain, sinus, or it is a gastrointestinal or the skin or any other disseminated type of the mucormycosis. So signs and symptoms will be depend on that only. First, if the person is having rhinocerebral or the sinus or brain mucormycosis, the patient may show the signs and symptoms like one-sided facial swelling. Means if you are a healthcare provider, if patient come to you, that time through the physical examination we can find out the symptom in the patient. So the patient will be having one-sided facial swelling. The patient may complain of headache, nasal or sinus congestion will be there due to the sinus infection. Next, black lesions on the nasal bridge and or the upper side of the mouth that quickly becomes more severe, and the patient may, due to infection, the patient may also have the fever. Next, we will see the symptoms for the patient with pulmonary mucormycosis. So, the symptoms with pulmonary mucormycosis include fever, cough, chest pain, and the shortness of the breath. Next, if the patient is having cutaneous mucormycosis, then that time through the inspection only we can find out. We can see on the skin like blisters or the ulcers, and the infected area may turn black. Other symptoms include pain, warmth, excessive redness, swelling around a wound. Means if the patient is having cutaneous mucormycosis, the patient can show the symptoms which I have already told you. Next, if the patient is of gastrointestinal mucormycosis, the patient may show the symptoms like abdominal pain, nausea and vomiting, and the gastrointestinal bleeding sometimes. Next, last one is disseminated mucormycosis. So, if the patient is having disseminated mucormycosis or the infection has already spread to the or come in contact with the blood stream, and mainly disseminated mucormycosis is also common, typically occur in the people who are already sick from other medical conditions. So it can be difficult to know which symptoms are related to the mucormycosis. Means disseminated mucormycosis, it is not very common. It is a rare one, and it is only occurring in the persons who are already suffering from any other disease condition. So sometimes it is very difficult to find out that whether the patient is having mucormycosis or not. So, patient with disseminated infection in the brain can develop mental status changes or the coma. Coma means if the patient is having disseminated infection and infection and reach to the brain, that time the person may show the signs and symptoms. There may be changes in their mental status, as well as if there is a severe brain tissue damage, the patient may go into the coma stage. Next, we will see what are the risk factors and who are at more risk to get this mucormycosis and how we can prevent the mucormycosis. First, who are at risk. As I already told you, it is a very rare, but it's most common among people who have health problems or take medicines that lower the body's ability to fight germs and the sickness. Certain group of people are more likely to get mucormycosis, including people diabetes, especially with the diabetic ketoacidosis. Diabetic ketoacidosis, it is a complication of the diabetes which causes the excess of blood acid ketones. Okay, so due to the excess of the blood acid ketones, there will be slowly damage of the tissues, and ultimately there can be if tissues are damaged, then there are more chances that an infection can affect the body of the individual more quickly. So if the patient is having diabetes or the complications of the diabetes mellitus, so they are at more risk of causing the mucormycosis. And the cancer patients, already their immune system is very weak. If the person has gone through any organ transplant, stem cell transplant, and if the person's body is having neutropenia is low number of the white blood cells. So why this low number of the white blood cells cause the increased risk of the mucormycosis. We all know that the white blood cells help to fight against an infection in your body, and so if already the immune system of the patient body is very weak, the body will be able to produce less amount of the WBC. So any infection can affect the body tissue. So at that time, if the patient is having neutropenia and less number of the white blood cells in the body, the patient can easily get a chance to get infection in their body. Long-term use of the corticosteroid use, corticosteroid drugs, injection drug use. If we are doing the injection drug use, or if we are using the corticosteroid drugs therapy, that time it also promote the growth of the infection in the body of the individual who are getting infection through the IV route. If we are not properly maintaining the aseptic techniques while giving the IV infusion to the patient, while giving the IV infection to the patient, so again there are the chances that the patient can quickly get the infection. Next, too much iron in the body, means if the condition is known as hemochromatosis. Hemochromatosis, what actually it is also known as bronze diabetes or the iron storage disease. Means it is a condition in which there is excess of iron absorption in the body. We all know that excess of anything is always, means excess of anything is not good. The thing should be in limits only. Iron is good for our health, but if it is not absorbed in our body, and if it is absorbed in a larger amount and not means absorption is more but excretion is very less, so at that condition there will be excess accumulation of the iron in the body. So when there is excessive accumulation of iron in the body, that time what it cause, it called the fibrosis of the tissues. Means the iron, when it is absorbed in the body, or if there is excessive deposition especially in the small intestine or the GI organs, so what it caused, ultimately it started to cause the fibrosis of the tissue and the tissue damage. So ultimately there will be damage of the tissue, and if this infection, due to damage of infection, due to damage of the organs, then the infection reach to the bloodstream, and through the bloodstream, through the disseminated mucormycosis, it can spread to the whole body. So iron, too much iron in the body can also cause, means it can also give a opportunities for to the fungus to get enter into our body. Then skin injury due to surgery, burns or the wound, prematurity and the low birth weight baby. So all these are the people who are at more risk of getting the mucormycosis infection. So ultimately, what is the in common root we get from this risk factors, means the person who are having very less immune system or whose immune system is weakened due to any other disease condition, they all are at risk of getting the infection of mucormycosis. How does someone got mucormycosis? Now the question is whether it is a contagious disease and how we are getting this infection. So people get mucormycosis through the contact with the fungal spores in the environment. For example, the lung or the sinus form of the infection can occur after someone inhales the spores from the air. A skin in infection can occur after the fungus enter the skin through a scrap, burn or other type of the injury. Means it is the individual is getting spores of the fungus or the spore directly from the environment. He is not getting these spores from while he is coming in contact with any other person. So we cannot say that it is an infectious disease. Means it cannot be spread from one person to another. Means what I mean to say is mucormycosis is contagious? What are the contagious disease? Contagious disease are the disease which can spread from one person to another, either through the direct contact or either through if the infected person uh, sneeze or cough. So if we are inhaling that sneeze and cough into our body, the pores of the sneeze and cough in our body, so that can cause the disease condition or the infection in our body, so that is contagious. But in case of the mucormycosis, it is not happening. The individual is getting infection directly from the environment. He is not getting the infection while he is coming with contact with the infected person or while he is inhaling the infected person's cough or the sneeze. So we cannot say that mucormycosis is a contagious disease condition. Next we will see how to lower risk of the mucormycosis. So few things we have to follow to lower the risk of the mucormycosis. First of all, protect yourself from the environment. It's important to note, although these actions are recommended, they haven't been proven to prevent the mucormycosis. Means recommendation has been given, but still it is not proved that these all will help out completely to fight against the mucormycosis. But recommendation has given, so we can follow them. So first, try to avoid areas with lot of dust like constructions or the excavation sites. If you can't avoid these areas, then we can wear N95 respirator mask while you are in that area. Next, avoid direct contact with the water damaged buildings and flood water after hurricanes and the natural disasters. As I told you, ki this fungus, they are living in the environment, or they can directly come into our body or come in contact with our body through the environment. Or fungus is growing in the wood, in the wet woods, and in the buildings which are damaged. So that if we are going to that area, we have to be very much careful. Next, avoid activity that involves close contact to the soil, dust, such as yard walk, gardening. If this isn't possible, means we have to avoid direct contact with the soil. And if we are not, if we can't avoid going to the, if we like gardening too much, if your occupation is that only, so we can wear some protective, personal protective equipments, like we can wear shoes, long pants, long sleeve shirts when doing outdoor activities such as gardening, yard walk, or visiting wooded areas. Wear gloves when handling materials such as soil, moss, or manure to reduce the chances of developing a skin infection. Clean skin injuries well with soap and water, especially if they have been exposed to the soil or dust. So these all are the uh, preventive measures which we can take to lower the risk of the mucormycosis. Next, treatment for the mucormycosis. We have to take, we are doctors, they are prescribing the antifungal medications to treat the this mucormycosis infection. So if you are at a risk for developing mucormycosis, for example, if you already had an organ transplant or stem cell transplant or any other infection, that time healthcare provider may prescribe medication to prevent mucormycosis and other mold infections. Next, where it comes from. The fungi that cause mucormycosis live in the environment. Mucormycetes, the group of fungi that cause mucormycosis, are present throughout the environment, particularly in the soil, in the association with decaying organic matter such as leaves, compost piles, and animal dung. They are more common in soil than in air, and in summer and fall than in winter or the spring. It means which is a suitable environment for the these fungus to grow is mostly they are occurring in the summer, and they fall in winter and the spring seasons, and they are more in soil area than the air. Most people come in contact with microscopic fungal spores every day, so it's probably means every day we are coming in contact with the various spores, various fungus. So it is means it is impossible to deny, or it is impossible to avoid in coming with these all mucormycetes. So these fungi isn't harmful. So what we need to do is we have to boost up our immune system so that this fungus will not get a opportunity to affect our body. Next, diagnosis. Now, how we will identify the particular person is having mucormycosis. So, what are the diagnostic tests for it? That healthcare providers consider your. So, if you are going to for the checkup of mucormycosis, if you see the symptoms like which I have already told in previous slides, so you can go to the hospitals, and the healthcare provider they can do, or we can, if you are a healthcare provider, through these procedures we can find out whether the person is affected with the mucormycetes or not. First, we will take complete medical history of the patient. We will ask for the sign and symptom to the patient. We will completely do from head to toe examination of the patient. Then laboratory test in blood examination. We will do complete blood examination of the patient. We will do. We can also we can also collect the sample. If we are seeing the patient is of a sinus or the lung infection, we can collect the sample of fluid from your from the respiratory system to send to a laboratory. Or if you are a healthcare provider, we can also do the tissue biopsy, in which a small sample of affected tissue is analyzed in the laboratory for evidence of mucormycosis under a microscope or in a fungal culture. Or we can also do the scanning like the CT scan and all of the lungs, sinuses, and other parts of body, depending on the location of the suspected infection. So these all were the diagnostic tests through which we can identify or they confirm whether either the person is affecting with a mucormycosis or not. Next one, treatment. For the treatment of the mucormycosis, as it is a fungal infection, so we will prescribe the antifungal medication to the patients. So the antifungal which we are commonly using are amphotericin B, posaconazole, or the isavuconazole. These medications usually we are giving through the IV route. Often, if the tissue or the particular part of the patient is completely affected or completely necrosed, sometimes we may need to do the surgery and cut the away the infected tissue or the part. So this was all about the mucormycosis. So in this class we discussed about what is mucormycosis, what are the causes of mucormycosis, so what are the preventive measures, who are at more risk, what are the diagnostic tests. So ultimately these are few steps we can follow to lower the risk of contracting mucormycosis. First of all, we have to educate our society about the disease condition. The need is we don't need to be panic. We just try to understand what is the disease condition and how we can prevent this disease condition. So first of all, it is very important to educate the society about the exactly what is the disease condition and how they can prevent from it. Second one is periodically, if we are seeing this disease condition is more common in the COVID patients. So COVID patients, they are admitted in the hospital. So in hospital, what we need to do is we have to periodically take the sample of the air in the hospitals, especially in the critical care wards, to check for the presence of any spores, because already the patient is in critical unit and their immune system is already weak, or if the air of the hospital is also infected or spores are present there, then the patient may inhale that spores and can be affected, and the death of the patient can be occur. And third one is we must ensure that the humidifier used during oxygen therapy are sterile, and at the same time the humidifiers which we are using in the hospital to give oxygen to the patient, we should periodically check the humidifier and we should change the water of the humidifier, and it should be sterile so that the patient will not get the infection of the mucormycosis. Fourth one is recovering patients should be advised to remain indoor until they regain their natural strength and immunity. We know that this mucormycosis infection is most common in the COVID recovered patient, as after COVID recovery also their immune system is not that much build up, so they can easily get an infection. So it's a responsibility of the healthcare workers that they should instruct or they should give a follow-up education to the patients at the time of discharge, that they should be properly use the gloves, mask, and they should be remain indoor for about 1 month or for about 3 to 4 weeks, so that they will not get any other type of the infection from the environment. Fifth, patient engaged in farming or gardening should be advised to lay off from the work until storms has settled. Or we have to, if our patient is a farmer or coming in more contact with the soil, so that time also we have to advise our patient that they should not come in direct contact with the soil, because if they are going direct contact with the soil and already their immune system is very weak, so they can get the infection of the mucormycosis. So these all things we need to tell to our society, and we need to understand that mucormycosis is nothing, it is just a fungal infection. What we need to do is to prevent ourselves from this disease condition, we need to boost up our immune system only. If our immune system is very strong, then we will not get this mucormycosis infection. So thanks so much for watching this video. Stay safe, stay home.